Rather than an apology for communication, recognition that this policy is not aligned with what Albertans want.
Despite an apology from Dr. Dina Hinshaw, protests calling for the reenactment of universal testing, tracing and isolation requirements are growing. And these people here aren't buying her comments.
I was confused by it because she said she was apologizing, but she was apologizing for the communication that was going along with it. Whereas I don't think the Albertans are really worried about the communication. They're worried about the policies themselves.
This is like way too far.
This retired nurse is taken aback by the government's timing on the rollback of the measures.
I can't believe they would do this like 2 weeks before school starts and everyone goes back to university and colleges. I would think if you're thinking of doing this, like at least wait until the end of September or sometime in October to see what happens when everyone goes back to school.
Protesters have been demonstrating since Friday. This one rescheduled to 6 p.m. to allow for more people to attend. Hinshaw apologizing Wednesday for the way she communicated the shift in Alberta's COVID-19 policies, but said we need to learn how to live with the virus without extraordinary measures, like legally mandating everyone stay home for 10 days if they have symptoms like a sniffle or a cough.
Scientifically, we're not at that stage yet. Yes, we will one day all have to live with COVID. It will become part of our lives, but that will be when we're not seeing an exponential rise in cases. That will be when we're not seeing novel variants.
Dr. Tayseen Lada has publicly written about Hinshaw's apology letter and dispelled some of the doctor's reasoning as to why these measures should be rolled back. One of them being to focus efforts on other health issues in the province and to spread out resources.
If we don't have the resources as a developed country in one of the richest provinces in the country to be able to mitigate COVID risk, then I don't know how any other country would be able to do so.
Currently, there are over 1 million Albertans who have not been vaccinated and over 500,000 children unable to be vaccinated. Dr. Lada says our vaccination rates are not high enough to create herd immunity, which she says is 85% of the population.
We're not at a state where the vaccination level is high enough to prevent COVID transmission.
And thank you for being here for us.
In Calgary, Taylor Braat, City News.